Welcome to today's interview of Doctors Insight with iOrbit. And today we have Philomena Hospital's renowned gastroenterologist, Dr. Praveen Kumar.
Thank
Hi
you.
sir, welcome to the show.
Thank you.
So sir, over the years of your experience, how have you seen the field of gastroenterology evolve? So with respect to the diagnostic tools and treatment approaches.
Over the years, with the new inventions like high definition scopes, the vision is very good. And also with the narrow band imaging, we are able to differentiate between benign and malignancies. And with the endoscope now, we are able to see complete intestine from mouth to anal canal. Before we had to open to see the small intestine. Now it is possible without that. And the AI is one of the boom where the diagnosis is made easy with the artificial intelligence. Using endobrain in the endoscope, we can identify the lesion as a malignancy, which type of malignancies, what benign lesion, all this can be done. And with the third space in the therapy, the third space endoscopy, we are able to do many therapies like POEM in case of achalasia cardia, and G-POEM in case of gastroparesis. And also we are able to do endoscopic mucosal resection and also endoscopic submucosal dissection and remove many tumors without open surgeries. And also personalized therapies using targeted therapies, biologicals and immunotherapy for IBDs. And in GI cancers, we are using genetic molecular profiling to give medicines which will increase the efficacy, and also result will be better.
So that was a very great answer, sir. So moving on
Thank
to
you.
the next question. So with the growing availability at home gut health trackers, stool tests, and digital system logs, so how do you see these technologies helping in the field of gastroenterology? Totally.
This technique is very comfortable because to make a diagnosis of colorectal cancer, we call it as a screening. The strips can be sent by post to the home, and what the patient can or person can do is, when he passes stool, just touch the strip to the stool and pack it back again in the post and send it back, and that can be studied in the lab for presence of blood. If the blood is there, then that person will be considered as a stool occult blood positive. Then he can be sent for colonoscopy to identify a malignancy. At home it is easy. And also there are apps to know the for IBS, where the person just has, after passing motion, he just has to show the camera of the mobile to the stool, and the app itself will classify the type of stool 1 to 7, that is called Bristol stool chart, and it will store in the data. That will that data will help the doctor to analyze the type of stool and response to the medicine. And also the continuous biometric can be used, gadgets can be attached to the body, and that can analyze the bowel sounds, all those things, and heart rate, anxiety, all those things can be monitored. And there is something called the Bravo capsule that can be, by endoscopy we will fix at the esophagus, and that Bravo capsule will monitor the acid reflux. Whenever the acid reflux into the esophagus from the stomach, it will store the data, and that will send to the gadget that can be studied by the doctor after 24 hours. When the patient comes back to the hospital, that can be downloaded and can be studied. And also there is something called ambulatory reflex monitoring also. Just put a catheter inside and send the patient home, and that can be recorded at home and brought back. And also there are some capsules where the capsule is swallowed by the patient in the hospital, and he can be sent home, and when he passes motion, the capsule comes out. That has to be can be retrieved with the help of a sieve and a magnet, and when it is brought back to the hospital, the data can be taken out, the photos of entire gut can be seen, and that will help to identify a bleeding lesion, ulcer inside the gut. These all can be done at home.
Nice, that is very good to know. So, moving to the next question. So, digestive disorders are increasingly linked to lifestyle choices, especially for the youth, being stressful and being sitting in for long hours with very unhealthy eating habits. So, what key habits or dietary changes can significantly reduce the risk of this common GI conditions?
See, one of the most problematic thing for majority of the people is constipation. So what I tell them is, when you get up in the morning, the to pass the motion, the motor starts, called awakening response. After that, person has to drink 2 glasses of water and go and sit for passing motion, whether it comes or not. And for about after 2-3 months, it becomes habit, and he will get the motion. And one thing we should not do, anybody should not do, is carrying a mobile to the toilet. Nobody should carry the mobile to the toilet. And eating food habits is that person should take lot of fibers, and fruits are very important to clean the blood vessels of the body, and also to decrease the colorectal cancers. More fibers are seen in the vegetable. The foods are divided into Nova 1, 2, 3, 4. Nova 1 is the natural food, and Nova 4 is a highly processed food. Better always adhere to natural food like rice, wheat, eggs, meat, fish, all those things. The processed foods are like chips and packaged food. They are not good because they contain a lot of preservatives, and it's not good for the health. And more of probiotics. Probiotics we find in the buttermilk and curds, and there are so many probiotics available, natural probiotics. And it is better to avoid smoke and excess of alcohol. These are important lifestyle modification for a good health.
Great. And even exercise help all this?
Yes, exercise is very important, especially the exercise will increase when you person does exercise, decreases the constipation also. And also the sleep is very important, because when the person sleeps, there is something called parasympathetic stimulation, and next day it is easy for the person to pass motion. The person who sleeps less will have more constipation.
Okay, nice. So, what recent advancements in minimally invasive procedures have had the greatest impact of a patient care in gastroenterology?
Yes, like we call it as a natural orifice procedures, like enter without cutting any part of the body, that is the skin, enter through the mouth and do the procedures like endoscopic mucosal resection. Through the mouth we go in and we cut any tumor in the mucosa of the stomach, esophagus, or in the colon. And also something called ESD, endoscopic submucosal dissection. So through the mouth we enter inside and we dissect the layers of the intestine, which is actually very small layer that is separated, and through that we go inside and we remove the tumor which is inside that layers. And also there is some procedures called POEM, where there is a condition called achalasia cardia, where the GE sphincter muscle becomes very tight. We dissect in between the layers and go and cut that muscle, and that muscle relaxes and it causes person to eat well. And also there is something called endoscopic ultrasonography guided gastrojejunostomy. Before it has to be an open surgery. Now through the endoscopic ultrasonography, through the mouth only, this can be done. The capsule is, nowadays there is something called it is may come within years. There is something called drivable capsule. A person will eat the capsule and that capsule goes inside. Once inside, the capsule can be driven from outside. The doctor will see the vision inside the stomach, and he can see the ulcer, any bleeding thing, and he can cauterize, use laser to burn that lesion and stop bleeding. This is not yet come, but there are prototype. Maybe it may come in few years.
So they can control the capsule.
They can control. Actually, it's like a submarine. Like they will put lot of water inside the stomach, and in the intestine lot of water will be there. That will act like a submarine inside the water, and it has a gadgets like some lasers, some radiation, some clips. It will go and clip the vessel if there is any bleeding is there, or it will burn, coagulate the lesion if there is any bleeding. Yes.
Great. So this is all the new technology and
Yes.
helpful.
Yes.
Yeah.
Yes. Yes.
So how important is the early detection of conditions like collateral cancer, IBD, or fatty liver disease? So what strategies can enhance public awareness and screening compliance for this?
See, the identification of colorectal cancer in Western countries, the any normal person after 50 years of age, every 10 years they go undergo a colonoscopy called as a screening colonoscopy. If there is an early cancer, if it is detected early, it can almost be cured. The survival rate is almost 90% over 5 years. So the early detection really helps. Like in case of the NASH, this fatty liver, the early detection of the fatty liver, if we tell the person you have fatty liver and you start doing exercise, reduce your weight, we can prevent him going for a cirrhosis and complication of cirrhosis like bleeding, end stage liver disease.
So they have to take a test every 5 years.
Yes, it's not only that. They have to do the test once in a year, like liver function test and also ultrasonography. And moreover, it is common in obese people. The frequency of screening should be more for the obesity and high risk individuals.
Is there any age factor to this? Like from which age should they consider doing a test?
Actually, there are no guidelines at present, and usually this has to be done for the fatty liver for those people who have risk factor like diabetes,
Okay.
and also for the obese people, and also for the people who have family history of liver failure. And
It is hereditary.
these are all related to genes.
Okay.
Okay, there are some people who are very lean. They are not obese at all, but they will have no diabetes, nothing. But they will be having fatty liver. This is because of the genes.
Okay.
And also, the detection of IBD in a children. There is in the children, detection of IBD is very important, because if we detect IBD and give treatment for IBD, the growth will be good. If we don't detect IBD in a growing age, the child will not grow, and by the age of 18 years all the bones will start fusing, and if we treat later, the growth, he cannot grow. So it's very important detection of IBD in childhood and immediate treat the IBD, so that person will go in the growing age.
So this is very helpful. So do you foresee a shift towards home-based virtual follow-up care for chronic GI conditions such as IBS or GERD, especially with digital health integration?
See, one of the important thing I have seen with the digital is like we get lot of patients with the fatty liver. They are very obese. So there are some apps which can be downloaded in the mobile, and that losing weight, and through the app only the person on the other side will control their weight. Daily we have to put in our weight, what we are eating, and from other side they will advise what you have to eat, how much calorie, how to modify your diet. And I have seen very good response. People are losing good weight. So it's a best treatment for fatty liver without any side effect rather than the medicine. And also one of the thing is nutrition. Through the mobile, also through the digital apps, a person can be guided, and especially for IBS and GRD, so like lifestyle modification, and also the IBS is associated with many stress. Okay, so the through the mobile, through digitally, through the telecommunication, the person can be counseled for the stress, anxiety, all those things, depression. Many times there is a depression, they will not tell, but these things will help for that.
So it's very helpful. Yes. So moving on to the next question.
Yeah.
How is precision medicine influencing the gastroenterologist approach conditions like inflammatory bowel disease or liver disease?
Yes. Nowadays, with the advancement of technology, we are going to genomics, means genomics. Like in case of inflammatory bowel disease, when I have to treat with some drug called azathioprine, though this drug is known to cause severe bone marrow depression, person can die within few days. So, to know whether there is a risk, we do some test called TPMT and NUDT15. This is a gene involved in the metabolism of the drug. So I can identify these genes and I can tell the risk of developing the complication. Then I can tell the patient, no, you cannot take this medication. I can prefer an alternate medicine for that. So this is what is also called as pharmacogenomics. And also we can use biomarkers, and we can use some molecules to predict the disease course, complication, and also we can tell the response to the therapy. So these are the, and also we can personalize the therapy also using all these genomics molecules, and also like we do that stool calprotectin in case of inflammatory bowel disease. By that we can assess the disease progression or disease response with the medications. These are the technologies.
So each medication can have different conditions affecting for different people based on
Yes,
their genes.
yes. Maybe one day there is a genetic mapping we can have in a pen drive. Before giving the medicine, the doctor can put a pen drive in the computer and it will give a list of medicine which will not good for the patient and which are better for the patient.
So moving on to the next question. Interdisciplinary collaboration, so especially with the nutritionists, endocrinologists, and mental health professionals. So it is becoming more common nowadays. So how does this holistic approach benefit GI patients?
It was there before also. Like in case of alcoholic liver disease, we say alcoholic liver disease. No, it's not alcoholic liver disease. Liver has not done anything. It's the brain has made the person to drink alcohol, and the liver has got damaged. So we don't have to treat the liver, we have to treat the brain. So whenever a patient comes with alcoholic liver disease, we send them to the psychiatrist and psychologist to counsel what made him to take alcohol. So the person has to be treated for the reason why he is taking alcohol. We need a psychiatrist, and we need a psychologist, and we need a hepatologist also to treat the liver disease, and also we need a nutritionist, because these alcoholic liver disease people, they don't eat, they don't know what to eat. So we need all these people, and it is a discussion with these people, discussing with each other, that will help the patient. And also with the NASH also, this nutrition is very important to lose the weight. And the recent advancement, we have something called GIP GLP inhibitors, where endocrinologist will not only treat the diabetes, and he can also treat the NASH also. So it's very important. Yeah.
So all of these are interconnected.
Interconnected. Yes.
So looking ahead, what innovations are research developments in gastroenterology, and what are you most excited in transforming the patient outcomes?
It's a digital, where we are using the apps, home-based medicine, and also telemedicine, and also more is the artificial intelligence also, not only for diagnosis, and also for the therapy. Maybe one day we may not have to cut the skin at all. We may enter through the mouth using what is called a natural orifice surgery, and use the endoscopes which have robotic arms, and also these are also assisted by the artificial intelligence. So I think also, like I told you, that drivable capsule, when we take the swallow the capsule inside, and we can drive actually capsule inside our stomach and intestine, and also we can see what is going on inside the stomach. Is actually sitting, it feels as we are sitting inside a stomach, and we are treating using laser, using the clips to stop bleeding, or take a sample, and if there is any hole, to close the hole. I think These are the future of the gastrointestinal medicine. See, whatever the advancement is there, whatever the advancement is going to happen, always the best is lifestyle modification and disciplined life and the food we take. So, in Kannada, we say, ಊಟ ಬಲ್ಲವನಿಗೆ ರೋಗವಿಲ್ಲ ಮಾತು ಬಲ್ಲವನಿಗೆ ಜಗಳವಿಲ್ಲ. That means you know how to eat, then you won't get the disease. Best wishes, keep good health. Thank you for iOrbit for bringing all this awareness to the people. Thank you.
And thank you so much, sir. You've been very helpful for bringing in public awareness to all these topics, which none of us were, like the youth were not aware about. Thank you so much.
Thank you.
It was
Thank
very
you.
helpful.
Thank you.